in contact with any other individuals. If they have been in contact with any other individuals, it will be following up and determining, making contact with those people and making sure that they have control orders on them if necessary, and identify all the locations that that they've been to during their period of infectiousness.
How long do you expect that to take?
It just depends on how cooperative people are. Sometimes people don't want you to know where they've been, but we're pretty good at tracking down places where they've been.
I just want to clarify something. Is it accurate to say that the woman was in Houston, whereas the man who's hospitalized was initially at the rural hospital? And then I have a follow-up question, which is, did Public Health advise Austin ISD to go ahead and cancel classes today?
No, but
we were in phone conference all day yesterday with a variety of elected officials, local elected officials as well as state elected officials, advising all of them that each one is acting under their own authority and will have to make risk assessments for themselves, including actually our festival community. We were also in a conference call with our festival community, apprising them of the circumstance so that they could assess their risks, and I think that you saw the results of that with 3 different events choosing to self-selecting to cancel their events. Similarly, when we have our phone calls with all of our elected officials, each one can make a decision independent of the other, although of course we do prefer that we make a decision together. We all, of course, completely support our AISD in the decisions that they make. But Travis County and the City of Austin are not closing down today. And if at a level 3, we have certainly reached out to all of our other elected officials as well as our institutions, both private and public, to discuss with them what level 4 looks like with regard to working from home, social distancing at work, reduced staffing, increased spacing, office sharing arrangements and whatnot. So at level 3 we plan. At level 4 we would deploy those new plans.
What about that clarification on just who was coming from Houston, who was coming from the rural hospital?
So one individual, the epidemiologic link was to a Houston case. The individual's from a different county other than Harris County, and the other one is from a rural area.
Is that why the woman was under monitoring, because she had contacted y'all, or that you knew she'd come back from Houston, or was she coming back from elsewhere?
We were advised by Montgomery County that the individual was a person under investigation at that stage, and at that stage we made contact with her and issued control orders.
And she lives here? She's a resident of Austin?
She's staying here.
She's staying here.
Yes.
Would the ISD cancel class today? Is this related to any of the cases? Did either of the patients have any contact with the ISD?
I don't have any information to that effect at this stage. As the judge said, entities are going to have to make a shared decision with their constituents. And, in some circumstances, the level of risk is not clear. The tolerance for risk is going to be lower. And, we work with our stakeholders. We work with our governmental officials, with our school districts, with our universities. We have conversations like this to help inform them what the best decision is that they can make for their constituents.
Let's go three more. Can you explain, in as simple terms as possible, just the difference between something like an airborne illness and something that is spread through droplets? I mean, what can people take away from this in terms of what their risk is walking down the street versus going to a business, something like that?
Sure. So airborne means it can travel on very small particles in the air, and because it's very small, those particles can float around for a while. Droplet means larger drops of water, if you will, or fluid, which tend to, if somebody's coughing or sneezing, it projects and then falls within 3 to 6 feet, which is why we talk about that 6 foot of separation between sick people to try to avoid that chance of spread. Let me be very clear. The virus is not going to jump up and grab you. If people stay home who are sick, it's not going to get you off the street. It's not going to jump off a table and get you, or off an airline seat and get you. It's generally, if it's not sick people in the community, then it's coming from surfaces. And when it comes from surfaces, it's because you touched it, and you've touched your mucous membranes, your eyes, your nose, your mouth, which is why we have to continue to reinforce that message. Wash your hands, use hand sanitizer, don't touch your face. If we can stick to that, if we can be steadfast, then we can really be impactful on limiting the spread. As I described in Commissioner's Court and Council work session earlier, if we can implement those non-pharmaceutical interventions early, if we can get the community really engaged, we can avoid hitting that rapid rise that we've seen in other communities that overstresses our healthcare system, and we will fare much better than other communities have in this outbreak.
Is the man who's in the hospital, is he in an isolation room, and then is the woman who's at her house, was she here to visit family? Is she with her family or friends?
She's staying with people in Austin, or the Austin-Travis County area. The individual is in isolation in an ICU setting.
Is that in a negative pressure room?
I assume so. I don't have those details at this stage.
What hospital is he at?
I'm not going to share hospital information.
You get one more. Go ahead. One more question. Anyone?
I would just ask what the balance is here between going out into the community to support some of these businesses that have been impacted by these major event cancellations. I mean, we're hearing, I feel like a little bit of mixed messaging here. Go out and support businesses, but also don't interact with too many people. What's the balance?
Yeah, again, this is where we need people to understand the risk generally. We have no evidence of person-to-person spread at this stage in this community. They also need to understand the risk personally. If you're over the age of 65, if you have significant health conditions, you need to be less tolerant of going out into crowded settings, restaurants, bars, and other venues where you might have a chance of contacting a sick person. If you're young and healthy, it should be less of a concern for you. Again, people are going to get this. Children are going to get this. Adults are going to get this. VIPs are going to get this. We saw Tom Hanks and professional athletes get this. It's going to happen, folks. But if we think about this with level heads, if we respond appropriately and stay home and get better, if we don't rush to the ER because we're concerned and we call our doctor, or we use one of the numerous telehealth resources that we have in our community and around the state, then we will do just fine. We have to avoid overtaxing our healthcare system with folks flooding hospitals and ERs who don't need to be there. And it's important that folks go to reliable sources of information like the website I gave earlier, the CDC, the WHO, to share and learn facts instead of fiction and fear.
Thank you all.
Thank you.
All of you are aware of the media line as we set up at the EOC. That would be for the email address that's available to you. That would be your best point of contact for any follow-up questions throughout the day. They'll also be the ones that you would reach out to if you had anything related to any of the policy issues that we discussed.
All right, that was a very informative presser. We learned a lot of information about both cases, a male in his 60s and a female in her 30s. Let's talk more, or at least first, about the male in his 60s, what we know about him.
Right, according to Dr. Mark Escott, who is the city's interim health authority, this patient was brought to Austin from a rural location somewhere else in the state. The doctor did not identify that location. He also did not identify the hospital that this patient is in. But one thing that we are now learning, of course, through that is that people who may become infected in rural parts of our state, may very well and apparently are being brought to major metropolitan areas where there is a more developed system and more potential to give them better treatment, or at least a higher level of treatment in a major metropolitan hospital like we have here in Austin.
And Dr. Escott did say the man in his 60s is in critical condition, not connected to the second case. A woman in her 30s believed to have come from Montgomery County near Houston, now quarantined. Neither of these people, it didn't sound like, are Austinites.
Right.
The man brought in, and the woman is visiting friends, according to the way they described it, but neither case connected.
And so I think also this information can help in many ways put our community at ease, that these are patients who have been monitored by local health authorities in their hometowns, as well as obviously once they got here to Austin. And so that monitoring has ensured that they have not been out in the community potentially spreading this virus. And that was one thing that at 2 o'clock this morning, when authorities sent out their first press release about these confirmed cases, that they really took tremendous steps to emphasize, and that is that these are not what they call community spread, that people know, they are known to health officials, and they know generally where they contracted coronavirus.
Okay, so 2 cases, they're not connected to one another. Obviously, there's a good deal of monitoring going on in both cases. And of course, we're going to continue to get more information as this morning develops.
That's right. We're going to take a quick break now, but we'll have much more from Tony and more on these 2 positive cases coming up. Again, you can text us for the latest developments. We'll have the very latest here. Text FACTS to 512-459-9442, and we will send you a link with the very latest headlines. Stay with us.
KVUE News is sponsored by Scott Felder Homes. Feel the wow sales event. Save thousands on premium options or closing. Visit scottfelderhomes.com today.
Ashley Home Store is celebrating our 75th anniversary with a house party. 2 days only. Celebrate and save 20% off store-wide, or get 0% interest for 75 months. Plus,
planning a staycation? Then come to the Hot Tub and Swim Spa Expo.
all of the urbanized areas in Texas, and we are in regular contact, have major hospital systems. And so it is probable that individuals who are suspected with having corona or other illnesses, other major illnesses, are transferred to our major metropolitan areas where we have very good medical care. So we are seeing this in Harris County, Dallas County, Tarrant County, Bexar County, and Travis County, yes.
And may in fact continue to see it as this progresses.
Yes, as one of the major urbanized areas with good hospitals, we can expect to play our role in the safety net for the entire state.
Judge, first of all, thanks for being with us. Second, I know it was asked during the press conference, what is the reasoning behind not letting people know in Austin where these two patients are located?
I think the doctor said it best. Dr. Escott said we're facing two epidemics. One is a health care circumstance, and the other is panic. Panic will weaken us, and we believe that it is absolutely necessary to share information with the public that we do have two confirmed cases and what the circumstances of those two confirmed cases are. But we believe that those individuals deserve their privacy, and also that it would only feed panic to provide a greater level of detail.
And Judge Eckhart, you also mentioned it's important to note that city and county leaders are continuing to meet on a regular basis, so this should also quell any kind of fears because preparedness is key, right?
Absolutely. What we are engaged in our 5-phased plan, which I'm very grateful, we are fortunate that we had this plan set up in advance and that we are moving through that plan in a predictable way. And so that plan makes it possible for us to prepare, to marshal our resources and prioritize those resources for when we do see person-to-person spread and eventual community spread. We will know where our resources are, where our most vulnerable populations are, and how to prioritize the deployment of those resources.
Judge, Dr. Escott indicated that in coming days that there may be future mitigation steps put in place to try to prevent the spread of coronavirus. Can you give us an indication of what some of those steps may be?
Absolutely. We had multiple phone calls yesterday with both private sector and public sector institutions about what it looks like when we go to person-to-person and eventual community spread, so that these institutions are prepared to go to teleworking, social distancing at work, different officing arrangements. We also heard, of course, from our festival community that asked for our input so that they could plan for their risk assessments for their events all the way out into the April timeframe. And we'll continue to meet with both public and private sector institutions and pump out information, quality information for them to make informed decisions about their risk profiles and the risks for their employees. So I can tell you that our entire court system has been deeply engaged over the last couple of days, along with the Office of Court Administration and other courts across the state, to figure out how we will continue to conduct court, both criminal and civil courts, if we do or when we do begin to see community spread.
Travis County Judge Sarah Eckhart, thank you so much for joining us this morning and answering some of these additional questions.
A lot of things to consider here. Of course, keep it at KVUE for the latest. We're going to have a short break, and we'll be right back.
KVUE News is sponsored by Greater Austin Allergy. Cedar fever making you miserable? Get your free skin test at any Greater Austin Allergy location. Visit austinallergist.com for details.
Okay, so maybe we're new to home improvement, but we're determined. We got an insider tip on the ultimate flooring destination. Whoa, Floor and Decor is amazing. Look at us. We're shopping alongside real-life designers and contractors. I love this tile. And this one. And these prices? Look at this. Durable and water-resistant. We should do the kitchen next. Oh yeah, we found where the pros go. Now we're unstoppable.
Explore Floor and Decor in person or online at
epidemics. You know, there's the pandemic associated with the virus, and then the one that you know, could be associated with fear. And we can't get lost in the second, and we'll lose the focus on the first. You know, this is a virus that is spreading everywhere. It's going to come to our city like it's going to come to all cities. And we know that, and this is progressing pretty much as we had anticipated that it would. When it comes to us, as it comes to us, we know that it's not a question of whether or not people are going to get it, but what is the speed at which people get it? We need to make sure we don't overwhelm our health infrastructure. And the best thing that we can do, that everybody should be doing, and it's real, is washing your hands a lot and fist bumping instead of shaking somebody's hand or bowing. And that's a hard thing to do. We've all been socialized to reach out and shake hands real fast, and we need to kind of break that habit here for right now. And that really is the most important thing that we can do. Stay home if you're not feeling well. Don't come into work sick. These are the kinds of things that will stop this virus from spreading too quickly as it comes to us.
Mayor Adler, this is Yvonne here. Can you talk to us about what the city, what you all are doing behind the scenes? Yes, we can do our part at home, but what's going on behind the scenes from leaders such as yourself to make sure moving forward that we stay safe?
There's a lot going on behind the scenes. The medical leadership and the other leadership otherwise throughout the region, constantly visiting with one another. We have a scheduled call once a day where everybody's on the phone sharing information. The medical teams with representatives from the 3 different hospital groups, the top physicians from Dell Medical School, meeting almost continually, just to make sure that we're doing everything we should be doing. But this is not a time to panic. And one of the questions that the doctor answered that I thought was a good question is, should people stop going out to restaurants and bars? And what he said was, you know, if you're elderly, if you have a compromised immune system, you know, you should probably give really serious thought to not heading out into crowds. But otherwise, there's not an indication at this point that that's something that should be avoided.
Go ahead, Tom.
Mayor, I just wanted to ask, we have a roster of events. When will we know about these events that are scheduled for the next few weeks?
Well, we know that some of the events that were scheduled, like the one out at CODA and Willie Nelson's event, the rodeo, are all things that organizers now have pulled down. We're continuing to have conversations with a large event organizers. We're going to be meeting about those continually. And as conditions change, if it's warranted, we'll come out with different additional orders. But we're looking at those big events now and seeing whether or not the rules we have should change as things continue to change.
Austin Mayor Steve Adler, kind enough to join us for a few moments this morning. Mayor Adler, thank you so much. Best of luck going forward, and we look forward to hearing from you on any developments in these cases. Again, you're hearing the news this morning from overnight. 2 presumptive positive cases in Travis County. One, a man in his 60s, critically ill in the hospital, brought into Austin from a rural community, we're told. The other, a woman in her 30s, currently being quarantined at home. Neither case connected.
Continue to keep it here to KVUE on air and online for the very latest.
Now through Sunday at the new Star Furniture and Mattresses. Beat the clock and save an extra 25% on everything in our showrooms. Hurry in now. The clock stops ticking at 6 p.m. Sunday. Shop and save 25% this weekend at Star.
The Culligan high-efficiency water softener is the world's best. It's backed by the industry's strongest warranty and serviced by the world's largest local dealer network. Click or call Culligan Water and start saving today.
We want customers to know that they can come and visit us at any time and know that they can always get a great value, there'll always be good deals,